Every single day, you take something like 20,000 breaths. Your lungs just expand and contract over and over in this perfect, seamless rhythm. But have you ever actually stopped to think about what keeps that whole process from turning into a grinding, friction-filled mess? Well, let's dive in. The answer is this incredibly thin, elegant, and absolutely vital structure called the pleura. It's really the unsung hero of every breath you take. And today, we're going to get a good look at exactly what it does and what it looks like when things go wrong. So, what is this thing? Okay, imagine you have two perfectly smooth panes of glass, right? And you put just a single drop of water between them. They can glide side to side with almost zero effort, but try pulling them apart. It's tough. That's exactly how the pleura works. You've got one layer lining your chest wall and another layer wrapped snug around your lungs. That tiny film of fluid in between is the secret sauce that lets your lungs slide around smoothly, breath after breath. Now, what's so cool is how we can actually see this super thin structure with modern imaging. When everything's normal, the two layers are pressed so close together they're almost invisible. On the left, in a CT scan, you can just make out that fine, delicate line. And over on the right, with an ultrasound, it shows up as this single, bright white line. This is our baseline, This is what a healthy, happy pleural looks like. So, what happens when we mess with that perfect system? All right, first up, what happens when air gets into that perfectly sealed gliding space? Well, that's a condition called a pneumothorax, and it basically shatters that pane of glass seal we were talking about. A pneumothorax literally just means air in the chest. It can happen for a few reasons, maybe from an underlying lung disease or some kind of trauma. But no matter the cause, air leaks into that pleural space, and when it does, it breaks the suction holding the lung to the chest wall. The lung's natural elasticity just takes over, and it starts to collapse on itself, making it really, really hard to breathe. And boom, here's exactly what that looks like. On a simple chest x-ray, the proof is right there if you know where to look. You see that fine white line? That's the edge of the collapsed lung, the pleura, that has pulled away from the chest wall. That dark area next to it, that's all air that shouldn't be there. It's an incredibly simple image that reveals a very serious problem. But we've got other tricks up our sleeve too. Ultrasound gives us this amazing real-time view right at the bedside. In a healthy lung, the movement of the pleural layers creates what doctors beautifully call the seashore sign, which you see on the left. It actually looks like waves washing up on the sand. But when air gets in and the lungs stop sliding, that beautiful motion just vanishes, and you get the stark, static barcode sign on the right. So seashore means everything's good, barcode means there's trouble. It's such an intuitive and powerful diagnostic clue. Okay, so we've seen what happens with air, but that pleural space can have the total opposite problem too. Way too much fluid. And we call this a pleural effusion. Now, not all fluid is created equal. Figuring out what kind of fluid it is tells doctors a ton about the root cause. It really breaks down into two main types. You've got transudates, which are thin, watery, low-protein fluids that built up because of a pressure problem. Think congestive heart failure. Then you have exudates, which are thick, protein-rich fluids that leak out because of an inflammation problem, like an infection. So it really all boils down to one simple question. Is this a plumbing issue, or is it an inflammation issue? And when that inflammatory fluid isn't just protein-rich, but it's actually pus from a nasty infection, well, that gets its own special name, empyema. This is a really serious situation. It's basically an abscess, a pocket of infection, trapped in that space right outside the lung. And here's a great example of where different imaging tools really need to work together as a team. The CT scan on the left, yeah, it clearly shows that pocket of infected fluid, the empyema. But look at the ultrasound on the right. It gives us a whole other level of detail. It shows these little walls, or septa, inside the fluid. Knowing those are there is absolutely critical because they can make the fluid much, much harder to drain out. Here's another really important visual clue that points to an inflammatory problem. This is called the split pleura sign. Remember how those two pleural layers are normally invisible, just pressed right up against each other? Well, here, inflammation has made both layers thicken up and glow brightly with the contrast eye. You can clearly see them as two separate bright lines that are split by the dark fluid in between. It's a direct picture of the body's inflammatory response in action. All right, so we've covered air and we've covered fluid. The third major thing that can go wrong involves the lining itself. This is when the pleura starts to thicken or grow, and the absolute most critical question here is it something benign or is it something malignant? Let's start with a classic benign example. What you're looking at here are pleural plaques. See those bright white, almost fossil-like patches along the lining of the ribs? These are a dead giveaway for past exposure to asbestos. They're basically just scars on the pleura, and while they tell a story about exposure, the plaques themselves are totally benign. So how in the world do radiologists tell the difference between something benign, like a plaque, and something much, much more serious? Well, this quote right here gives us the clues they're hunting for. They're not looking for thin, smooth lines. They're looking for significant thickness, over a centimeter, and for shapes that are irregular, lumpy, or nodular. And this comparison just makes that difference crystal clear. On the left, we have a benign tumor. Just look at how smooth and well-defined that border is. Now, look to the right. That is malignant mesothelioma. It's not a neat single mass. It's this thick, lumpy, irregular rind that's literally encasing the lung. The visual difference is just night and day, and telling these two apart is one of the most important jobs in all of chest imaging. So, as we've seen, figuring out what's going on with the pleura isn't about just one test. It's about using a whole toolkit of imaging technologies. Each one acts like a different kind of detective, uncovering its own set of unique clues. And each tool has its superpower, right? The chest X-ray is your quick first look, the scout on the scene. Ultrasound is the master of real time, perfect for spotting fluid and checking for that all-important lung slide. The CT scan is your high-def 3D map, giving you incredible detail on any thickening or complex fluid. And finally, PET/CT adds another layer, a metabolic map, showing which areas are burning energy like crazy, which is a huge clue for telling benign from malignant. Put them all together, and they solve the mystery. So you see, from a simple membrane that just lets us breathe to this complex diagnostic canvas, the pleura really shows us how much we can learn just by looking inside the body. The power of these tools to make the invisible visible it's just astounding. And it really makes you wonder, with technology like this, what's the next great medical mystery we're about to solve? Thanks for joining me.